Okay, let's talk about a situation that is, frankly, terrifying. An accidental exposure to a blood-borne pathogen. Your heart is pounding, your mind is racing, but what you do in these next few minutes is absolutely critical. We're going to break down, step by step, exactly how to handle this so you know what to do when every single second counts.
So let's put you right in the moment. Bam, a needle stick injury just happened. A clock starts ticking. You've got 60 seconds. What is your very first move? In a moment that's stressful, having a clear plan isn't just nice to have, it is your single best defense.
All right, first things first. Section 1 is all about what you need to do immediately. We're talking seconds and minutes here, and these actions can make a huge difference in minimizing your risk. Here is your 4-step playbook. Step 1. You actually want to encourage the wound to bleed a little bit. I know it sounds strange, but you're trying to let it naturally flush itself out. Step 2. Get to a sink and wash the area really well with just plain old soap and water. Step 3, if there was a splash to your face, your eyes, your mouth, you need to flush, flush, flush with tons of water. And finally, step 4, get that area covered with a clean, impermeable dressing.
Now, this next part is super important, and it might go against every instinct you have. Whatever you do, do not scrub the wound or douse it in harsh antiseptics like bleach. It feels like the right thing to do, doesn't it? But scrubbing can create these tiny little micro tears in your skin, which is like opening up even more doors for a pathogen to get in. So just remember, a gentle wash, not a frantic scrub.
So, you've done the immediate first aid. Take a breath. Now what? Well, Section 2 is all about calmly figuring out just how risky this exposure actually was. This quick evaluation is going to guide every single decision you make from here on out. Basically, exposures fall into one of 3 buckets. At the bottom, you've got minimal risk. This is where your skin wasn't even broken. Maybe it was just contact with low-risk fluids like saliva. Then you have low risk. Think of a shallow scratch from something like a suture needle. But high risk, that's the most serious category. We're talking about a deep puncture, maybe from a needle that was used for a blood draw, especially if you can see blood on it. Knowing which category you're in is absolutely key. Okay, so you've done first aid and you've got a good idea of your risk level. Now it's time to make some critical decisions. Let's dive into Section 3, the crucial next steps. And really, your entire path forward from this point hinges on one single massive question. What do we know about the source patient? The answer to that question changes everything. Think of this as a fork in the road. Down one path, maybe the source patient is known to be negative for any blood-borne pathogens, and your exposure was minimal. Phew, you're probably in the clear. But down the other path, if that patient is known to be positive, then treatment is almost certainly required. We call it PEP. And here's the kicker. You also go down that treatment path if the patient's status is a total question mark or if they refuse to be tested. You just can't afford to take the risk. So let's make this crystal clear. If your exposure was low or high risk, and the source patient is either positive or their status is unknown, the protocol is non-negotiable. You report the exposure immediately. No hesitation, no I'll do it in a bit. This action is what kickstarts the official medical evaluation to get you the care you need without any delay. And that brings us right to our next section, understanding PEP. Because if you've had a significant exposure, this is the medical intervention you really need to know about. So what on earth is PEP? Well, it stands for post-exposure prophylaxis. It's a fancy term for a simple idea, a course of powerful antiviral drugs that you take after you've potentially been exposed. The whole point isn't to cure a disease you have, it's to stop an infection from ever getting a foothold in your body in the first place. Think of it like an emergency brake. Now with PEP, timing is everything. For this treatment to have the best possible chance of working, it has to be started within an incredibly tight window, ideally just 1 to 2 hours after the exposure happened. That clock is officially ticking. And there's a hard deadline. After 72 hours, the effectiveness of PEP drops off a cliff. The virus may have already had too much time to set up shop in your system. This 3-day window is exactly why reporting immediately is so vital. Now, if PEP is prescribed, you've got to know it's a real commitment. We're talking about a full course of powerful medications that you have to take every single day for 28 days straight to give your body its best chance to fight off any potential infection. So let's just quickly recap the key things to know about PEP. It's a 28-day course. You have to take it exactly as directed, no skipping doses. You should be prepared for possible side effects. Things like nausea and fatigue are common. You'll also need follow-up blood work.
And it's really important to know it is not a 100% guarantee. But the single most important factor, the one that trumps everything else, is speed. The sooner you start, the better it works. Period.
You know, we've spent all this time talking about what to do after an exposure has already happened. For this final section, let's flip the script and talk about the most powerful strategy of all, making sure it never happens in the first place. And this chart, it really puts everything into perspective. In the official hierarchy of workplace safety, all the stuff we just talked about, post-exposure management, is considered the least effective control. It's the last line of defense. Way, way more effective are things like engineering controls, and at the very top, the absolute best method is just eliminating the hazard altogether. So what does this tell us? It tells us that while knowing these emergency steps is essential, the real goal is always prevention. And that leaves us with a pretty important question, doesn't it? What systems can we build so that a guide like this is never even needed?